And we're live.
Great. And are you recording this, Olga?
Yes, we are.
Perfect. Welcome, everybody. I'm Robert Sakata. I'll be co-hosting the meeting today for the Agricultural Behavioral Health Community of Practice Work Group. And the first thing we want to do is we have the opportunity for those of you that would like to have Spanish translation, have that option on Zoom. So at this time, I'd like to introduce Maite, who will be doing the translation today.
Hola, buenas tardes a todos. Muchas gracias por tenerme aquí hoy. Simplemente darles unas indicaciones de cómo funciona la interpretación. Si ustedes desean escuchar esta reunión en español, en cuanto yo termine de explicar esto, aparecerá en la parte inferior de la pantalla un icono de un globo terráqueo. Les pido por favor que cliquen y aparecerá ahí los dos canales en los que pueden escuchar y seleccionen el canal de español. Les sugiero que silencien el canal principal para que no tengan que escuchar los dos idiomas a la vez. Y si van a intervenir, les pido que lo hagan de una forma pausada para que yo pueda asegurarme de interpretar todo como debo. Si ustedes están conectando a través de un teléfono, tendrán tres puntitos en la parte superior de su pantalla. Por favor, presionen ahí, aparecerá la opción de interpretación y de la misma manera podrán seleccionar su interpretación. Espero que disfruten de esta reunión y si necesitan algo, no duden en escribirme en el chat para yo poder asistirles. Muchas gracias y espero que disfruten. Okay, I'm ready.
Thank you very much for that.
Thank
And so
you.
as a reminder, everybody, if we could speak clearly and try not to speak too rapidly so that the interpreter has an opportunity to translate it for us. So thanks again very much. So all of these meetings, of course, will be open to the public. Those involved in the public are on the webinar side, and so they can hear and see us interact as a work group. There will be an opportunity for public comment at the end of the meeting, and you'll do that by typing in your question into the Q&A section, and we'll go over that. But at any time, if you have a question, if you want to fill that in, feel free to. And then, of course, I'm Robert Sakata. My email address is on the bottom. At any time, we welcome your comment about the process or about any things that you feel like the Department of Ag should be engaged in on this area. We really, really welcome your comments. So please don't hesitate to email me at any time. At this time, too, I'd like to recognize my fellow CDA team members who really have been instrumental in helping us get this meeting kicked off today. Olga Robak is our Director of Communications and Public Awareness. Bethany Howell is Director of Strategic Outreach and Engagement. And then Rosie Scavron is our Program Assistant in Conservation Services. Thanks, everybody, for all of your help. And please don't hesitate to chime in if there's something that we need to take care of along the way. Just real briefly, the meeting agenda. We're starting off now. We'll have the welcome. I'll briefly go over the roles of Department of Ag, Behavioral Health, and Colorado Department of Public Health and Environment. Then I'll introduce our chair, Clinton Wilson, and he'll take over from there where we'll have appointee introductions. We'll actually review the legislation, talk about developing a charter and a work plan, and then also look at the schedule for the coming year. And then right after that is when we'll have public comments and the next steps. And again, please, if there's any time that any of the workgroup members have questions or comments, don't hesitate to raise your hand and we'll try to get those answered right away. Really appreciate your willingness to participate in this important topic. I really think that one of the main meeting objectives today is really to get to know each other. I think we're really lucky to have representation from all across the state of Colorado. It's meant that we had a little bigger group than we originally had planned, but I think that's important because in my travels, as many of you know, I'm the Ag Water Policy Advisor, and as I've traveled the state, it's really become apparent, that each community is unique. The people in the community are unique and special, and so I think a lot of times that how we approach those things also need to be unique. And we'll talk about the requirements, as I said, about the legislation that was passed this legislative session. Really want to thank the legislators that were involved in this and the ag organizations that supported this effort. Really allowed the Department of Ag to take and move forward with this work group effort, which I think is really invaluable. We'll develop a schedule for the charter and then the work plan, and again, identify next steps. Really briefly, I think we're all probably overly used to Zoom by now, but I found this, I was in a meeting on Monday and actually they went over this and I thought, you know what, it's probably a great review that we start off our work group process with this. Number one is to make sure that everybody knows that the meetings are recorded. And if you can, please keep your camera on. It's kind of nice to see each other as we're having these discussions. I realize that a lot of times there's bandwidth issues and you have to shut it off. That's perfectly fine. Well, we'd ask, of course, that you mute yourself when you're not speaking, because sometimes that background noise can overtake who is actually speaking. Raise your hand if you'd like to speak, and at least in the beginning, if you could introduce yourself when you speak so that we could kind of get to know everybody here. As we all know, I think it's really important that we respect all ideas and others' views. If you happen to be, I don't think we have anybody calling in for the work group, but if in the future, if you do, press 6 to mute and unmute yourself, and then press 9 on your phone to raise your hand. The participation agreement is really, and I think all of you, I've gotten to know many of you, and I think we're excited to be engaged here, and that's important that we're present. So, please limit any outside activities. It's something that's pretty easy to do when we're meeting virtually. We really don't want any single person to dominate the discussion. So I'm sure Clinton and I will be asking those of you that may have not said something to speak up. And we're not picking on you, but we really want the opportunity for everybody to have the opportunity to provide their input. Ask questions anytime. And if somebody sees a hand up where one of us that's chairing doesn't see it, please let us know, because it's hard to keep track of everything at once. We'll consider all viewpoints, including those outside of this space. I mean, I think we're all aware too that we represent a small community, and there's those outside that we also want to represent. And we want to be solution oriented. Really want this process to be valuable. We listen to seek understanding of all perspectives. And it kind of, if you feel it's necessary, explain the reasons behind your statements. As I mentioned in the beginning, I really want this process to be productive for everybody. A CDA's role, Commissioner Greenberg sends her regrets that she wasn't going to be here. She really wanted to. She really believes in this important work that we're doing. But unfortunately, the JBC committee had set up for the Department of Ag to make their presentation today. So she wasn't able to attend. But she really wanted me to relay to you all how important this is. She's fulfilled her statutory authority to appoint at least 7 members. I think we have a total of 15 or 16. The other statutory requirement was that we have the first work group meeting before January 1st of 2025, and this fulfills that requirement. And also we have in statute, it creates an agricultural behavioral health grant program. But unfortunately, the legislation didn't provide any funds. We're currently looking to see if we can find some funds to support that program. And if any of you or anybody in the public knows of places where we could get some funds to utilize that grant program, we'd welcome that input. We also are going to contract with a statewide ag organization to put on an annual summit for organizations with interest in ag behavioral health. The first one occurring no later than the end of next year. And then, of course, the Department of Ag will be responsible for submitting an annual report to the Colorado legislature. And now I'd ask Megan Shelton, if you wouldn't mind coming online and kind of explaining a behavioral health role.
Thank you, Robert. I'm happy to. Hello, everyone. I am Megan Shelton, Director of Strategy Planning and Engagement with the Behavioral Health Administration. And I am currently in the process of developing a PD, which hopefully will be posted this week, to create a manager, a program developer, and engagement specialist position that will designate a program for specific to agriculture and rural communities. And then they will be tasked with engaging throughout the state. So all of Colorado, they will be putting together a framework for how to engage with and serve our underserved populations within the agricultural communities. So heavy focus on that, very collaborative effort with the Department of Agriculture. And they will also be tasked with coordinating training to serve farmers, ranchers, and agricultural workers and their families all throughout Colorado. Additionally, they will be part of this work group, and I will be supporting them through this process. What did I miss, Robert? Anything?
No, that sounds great. So it sounds like really this work group could be really valuable to that person to provide them some insight in the roles that they'll be playing.
Absolutely. Incredibly valuable.
That's great. Because another idea, and I'll throw this out later, but another idea I had is really we should train those entities that are serving the agricultural community. Because as a farmer, sometimes I'm talking to my seed dealer more than I am anybody else, and they may have an indication that, hey, Robert doesn't seem right, quite, up to par. And so I think that may be another avenue that we can approach and talk about later. But
Another thing that I'll mention, Robert, is we have regional engagement specialists within my team that they focus on all underserved communities throughout Colorado. And so they will be working very closely with this position as well. So it will be definitely a collaborative effort because it's a big lift in making sure that we're getting out there and we're doing it in a meaningful way that really reaches these specific communities.
that's great. I know I'm not trained in this area, so I'll probably be reaching out to you a lot to learn more about what you guys are all doing and what's going on. I think that'll really be helpful for me.
Wonderful. Thank you.
Thanks, Megan.
And Robert, I see Clinton has his hand up.
Oh, thanks. Clinton.
Hey, Megan, I just had a question. The new hire, will they be joining this working group as well with you?
Yes.
Excellent.
Great. Thanks, Clinton. Thanks, Megan. All right, Catherine, you want to introduce yourself to the group and explain what the Department of Health's role will be?
Yeah, of course. Hi, everyone. I'm Catherine Harvey. I work for the Colorado Department of Public Health and Environment, and I am on the team that's the Office of Suicide Prevention. So we are the lead entity for suicide prevention, intervention supports, and postvention efforts across the state. And we get a lot of funds out into communities directly so that they can be implementing comprehensive suicide prevention. I am the rural strategy specialist. I've been in my role for just over half a year now, and my job is to be supporting rural, frontier, and agricultural communities when it comes to how do you adopt and implement upstream suicide prevention approaches. So whereas the BHA kind of focuses more on the direct behavioral health side, what services are available, I'm more on the side of what can we do so that folks aren't needing to necessarily even utilize those services in the first place. And I'm really excited to work with you all in this position.
Fantastic. Thanks, Catherine. It sounds like you're actually on the road a lot too. In the communications we've been in, it seems like you're traveling a lot to really help this community.
Like the past 3 months, I was more not at home than I was actually like being at my laptop. But hopefully now for the winter, I can chill out a little bit and just be at home.
Yeah. Well, we appreciate all of that you do. And now, I guess before I introduce Clinton, I should have.
Hey, Robert, I got one more question, though. I was going to ask Catherine.
Yep. Go ahead, Clinton.
Catherine, I was on a call earlier today, and they were mentioning the CNC and wondering, is that something that you work with as part of your CDPHE role?
Yes, I am one of like the 3 contract monitors for the CNC. So for those who aren't familiar with the acronym, it's the Colorado National Collaborative Project. And we give out money to, I forget how many counties. I want to say it's like maybe 15 now. But it's a whole bunch of counties in Colorado, and we're funding these direct CNC coalitions to be able to implement suicide prevention on the ground in those counties, and it includes a bunch of rural and frontier counties. So I'm essentially the point person for most of like our rural and frontier work for CNC. So yeah, that's right, Clinton.
Yeah, that was just really exciting work when I was talking with them earlier, and so I'm hopeful that you can give us updates on what's going on around the state, not today, but at other meetings, just in regards to that work, because it seems like that they are definitely plugged into those rural communities.
Yeah, I would absolutely love to do that.
Yeah, thanks, Clinton. And that's a great point. One of the agenda items later on you'll be seeing is that topics of discussion or topics of presentations that you folks would like to hear about. So if there's something from BHA or something from CDPHE that you think would be important for us to hear as a group, jot that down and we'll take that input in when we talk about our future agendas. And then I kind of failed to really introduce myself. Sorry, everybody. So I'm Robert Sakata. I'm with the Colorado Department of Agriculture, but also our family has a farm in Brighton, Colorado. So I grew up on the farm in Brighton and been there almost my whole life. I actually went off to CU because when I graduated high school, last thing I wanted to be was a farmer, and went to CU and studied molecular cellular developmental biology, worked for Amgen for a while. And then, make a long story short, I eventually found out that really my home was really being back on the farm. But just this about almost a year ago, January, I had the opportunity to start in the Department of Ag as the Ag Water Policy Advisor. And my interest, almost my entire life as working on the farm has been water. And just like the tribes that we have in Colorado, water is life. And I felt like that was so important to our operation that I focused in on that. But when the opportunity came to lead this process, I immediately raised my hand. It's really a passion of mine. As I mentioned, although I'm not trained in behavioral health, it really is a passion like so many people, and I really wanted to be involved, so jumped on the opportunity. So I'll be heading up the effort here at the Department of Ag, and don't hesitate with any questions or comments. Again, don't hesitate to reach out for me with anything. Now, the chairperson for the group has been designated as Clinton Wilson, who you heard ask a couple questions. So his responsibility, he's been designated by the Commissioner of Ag to chair this. And of course, he'll be chairing the meetings from now on. We'll be kind of co-chairing. And again, if anybody has any questions or comments, we want this to be a dialogue as much as possible. But Clinton, I'll turn it over to you and let you introduce yourself and take it on from here.
Great, thanks. Don't go too far, Robert. We are co-chairing this, so I'm going to be leaning on Robert a lot throughout this process. Really excited to get to be working on this working group with you all. When I was growing up, I grew up in Texas on a small farm there, and was not really aware of all the stressors that people working in agriculture were under. And as Robert did, I left rural Texas and went to school and ended up getting a degree in counseling psychology up in Seattle, and worked in public services for about 15 years up in the Seattle area. Moved to northern Colorado and got involved in agriculture again because I missed it, and my roots really were connected with agriculture. And after plugging back in with this new lens to see the stressors that farmers and ranchers are going through, trying to be a part of agriculture today, I made my way back to get involved in this capacity, supporting the behavioral health needs of farmers, ranchers, agriculture workers, and their families through a role at Rocky Mountain Farmers Union. And so I know some of you through that position. I started a program called AgWell there, and have been working, supporting the kind of behavioral health, stress management, suicide prevention efforts of Rocky Mountain Farmers Union for the past couple of years. And in October, I joined the Colorado Agribility Project, Colorado State Extension team that is working to promote behavioral health support for farmers, ranchers, and agriculture workers and their families across the state. And really excited to be a state program specialist with that team. For this call, I will be wearing my RMFU member hat. One of the designations of the legislation was that the chair would be a member of a statewide agriculture advocacy organization and nonprofit. And so for this chair position, I'll be doing that. But really excited to be here. I think that the only way that we're going to be successful at addressing these needs, or continuing to grow our success, is by doing it together. And so I've worked with some of you before, but those of you that I haven't, I'm really excited to get to partner and for us all to be here. So with that, I think we're going to jump into introductions of all of you so that we can get to know each other. This meeting is going to be a little different than the others because we're not going to have the specific focus that we're moving towards, but more just to, as Robert said, get to know each other, and then also go over the statute, and then at the end kind of figure out what our next steps are. So with that, Robert, I don't know if you want to throw back up the slide that has the list of all of us, and that way people can just go in order along those slides. And when Robert and I spoke earlier, we decided that if everybody could just say who they are, where they're from, even though where you're from is right there on this screen. But if it's different than that, let us know. What kind of work you do and why you submitted to be on this working group. And if you can kind of gauge it around, we've accounted for 3-ish minutes for everyone. So if we can stick close to that, I think that'll keep us on track so that we can get everything in. And with that, I'm going to pass it over to you, JC.
Thanks, Clinton. Good to see you. JC Carrica with Value-Wide Health Systems. We represent 14 counties in southeast and south central Colorado. We're a federally qualified health center as well as a community mental health center. I was one of the ones that actually testified in support of this bill. So I'm happy that we were able to make this work. Much needed for sure. I think my involvement twofold. One, as I was asked by the Colorado Behavioral Healthcare Council to apply for this position to represent really the statewide community mental health center network. And I think they picked me because I'm by far the loudest rural voice in the room. People that know me are all laughing and smiling. But I would also say it's because of our work with the Coffee Break Project over the last 6 years and some of the upstream work we're trying to implement around mental health well-being, suicide prevention, and gun safety, not gun control, but gun safety when we talk about suicide prevention and lethal means. And fortunate for me, I have a great team that helps support me. I'm not a one-person band with Value-Wide. There's an outreach team that also is promoting many of our initiatives that are related to this, including supporting health outcomes for agricultural workers. And we have 2 mobile response vehicles that we actually take to warehouses, factories, and fields to do health screenings. So very involved with the work, and I appreciate this opportunity. Do you want me to pass it on, Clinton, or do you want to pass it back to you? All right, I'll pass it to Amy Cooper, Grand Junction, Colorado, please.
I don't know that Amy's on, is she?
Well, my first duty I failed at. Let's try Jessica Duke with Yuma.
I'm Jessica Duke. I currently live in Yuma, Colorado, although I grew up in Texas as well, in kind of a small farm area. I have joined this group. I work in Yuma at a critical access hospital and a rural health clinic, and I have joined this group because of my own personal experiences with suicide, which I attempted twice in 2016 and 2017. My aunt committed suicide, and I've been, kind of surrounded by people experiencing these challenges for many, many years now, and it's very close to home for me. And so it's something I'm very passionate about, experiencing a lot of the things that, cause someone to be in this position, and then my work at the hospital and my, differing perspective at kind of some of the challenges we see that aren't necessarily, personal in dealing with things like this, but, challenges with insurance and healthcare. And from that perspective, I feel like I have a pretty well-rounded approach to kind of looking at something like this. And so I'm very excited to be here, and I'm really glad that this is something that the state's focusing on is important.
Thanks, Jessica. And we can just keep going down the list. Next to you, Julie.
Thank you. My name is Julie Elliott, and I'm the Behavioral Health Specialist for Colorado State University Agri-Ability Program. I'm located, it says Fruita on the list, but my office is in Grand Junction. We're 10, 15 miles from one another. And I've been in this position for about 1.5 years. I cover 16 counties along the western slope, meeting with the extension agents in each of those counties, as well as kind of the boots on the ground, working with people in agriculture who may have difficulties in getting or knowing what benefits are out there for them, or what programs they can utilize. I'm a 5th generation Colorado ranching family, or from a ranching family. And so this is something that agriculture is something that runs very deep in my family. I'm also a licensed professional counselor in the state of Colorado. And when I got the opportunity to kind of put together both things that I love, agriculture and mental health, into one job, that's really what kind of drew me to CSU as well as to this committee. I think that there's a huge need out there, and having people who have an agricultural background talking to other people who have agricultural backgrounds about behavioral health is just, I think, a win-win situation. Otherwise, we have a lot of people who are counselors and things like that that may not have the behavioral or the agricultural background, and trying to talk to farmers and ranchers, they don't oftentimes understand what the farmers and ranchers may be going through on a day-to-day basis. So anytime that I can help promote that, that's something that I would love to do.
Great, thanks.
Yeah, I think the next one is Michael.
Yeah, hi. My name is Michael Lozano. I am a combat disabled veteran. I spent 14 years in the United States Marine Corps, and I retired out of the Air Force Reserve in 2021. I was medically retired. I am a suicide survivor myself. My wife and I established Warhorse Ranch, which is we do equine therapy for veterans, first responders, and anybody with trauma. We have had a few ranchers going through our retreats in the summer. We're part of the Yampa Valley Safety Net. We just established this 3 weeks ago. One of our friends committed suicide. In Routt County, we've had 18 suicides so far for this year. And we just decided we are going to get together with the other groups in Steamboat, which is a huge ranching community. So we're getting with Reaching Everybody Preventing Suicide, the Foundry, other organizations that are mental health. We just want to give people resources, and the resources we give, they're going to find an immediate result, as opposed to just giving a number and then everybody's booked out. But we're going to facilitate before the end of the year assist training. We are on a response team with reps, Reaching Everybody Preventing Suicide. I also have a veterans beekeeping program that I started last year, which was very successful, where the veterans go out and I teach them everything I know about the bees. They harvest their honey, and I'm getting them into the Ag Alliance so they can start selling their honey. I'm also part of the Farmer Veterans Coalition, which right now we're in the process of developing a chapter in Colorado. And we also work with the Northwest Colorado Veterans Coalition for all this. At Warhorse Ranch, we have a physical therapist, dietitian that deal with trauma. We have an occupational therapist and 3 psychologists, which help us with Warhorse. So where we're at is I've been doing this for 5 years, and it's becoming bigger and bigger. And now we are reaching out to the community, and we just need to help prevent suicide and make sure people come out and just be part of the ranching community, which coming up here at Warhorse Ranch. So with that, we're always busy. And for the veteran side, I have gotten a USDA grant, and it really helped my self-esteem. And we're starting cows this year, or last year we started. We have 4 cows, 11 horses, and a donkey. So the veterans come out, and even if they don't go through the program, I'm in the jail. I do the jail ministry every Tuesday. And what I do is make sure everybody has their benefits as veterans. But with the people in the jail, what we do is provide mental health resources as well as addiction resources. So we do work closely with the addiction, and we just try to help everyone we can, because we've been through the road, we've been down that road, And people come to us because we have similar backgrounds. And for that, that's it for now. Thank you.
Michael, it's good to see you, man. It's been a while since I came out and visited Warhorse. Really glad that you are on the working group. Michael's work and his wife's work is really fantastic what they're doing out in northern Colorado. And so I look forward to you sharing some updates on what you guys are doing, because it sounds like you guys are cruising.
Yes, thank you. Appreciate it.
Is Kate on? Then we'll go to you, Tim.
Great. Thanks, Clinton. So yeah, my name is Tim Miller. I am the State Policy Director for the Colorado Farm Bureau. Been in this position since, I guess, near the end of May. So going on almost 7 months now, I guess. And before this, in another life, I was actually I was a regional director of state affairs for the American Psychiatric Association. They're based in DC, and I was based here in Colorado. And so I've worked on this topic, not just here, but in states out in the western part of the country. So when I applied for this and when I got hired for this position, I actually didn't realize that I was going to get an opportunity to combine this work. So I'm really excited to utilize not just some of the experience that I've had and some of the understanding, but also to hear a little bit more from some of the other panelists and group members. One of the first things that I did when I was hired here at Farm Bureau was I watched, there's a documentary that we put out that with the Department of Ed called Legacy, and hopefully some of you, if not all of you, have seen it on this work group. But it was one of the first things that I did, and it was one of the first things that I knew that that's something that I had to get involved in here, is just based off of, again, my own experience in my career, and just the opportunity to do things for our membership here. As we all know, it's a very, farming and ranching is a very, very stressful industry, very, very unpredictable in terms of just to start with the Colorado weather, right? And so, what I hope to at least bring to the table is, again, just kind of some of the, not just my own background, but just be able to help convey this to, be it the general public, be it at the state legislature or other staffers. I really just want to make a huge difference in this area. So I'm looking forward to talking with everybody and hearing from everybody, and learning what we at Farm Bureau can do. Some of you also might know of the camp program that we administer here, that's been successful. And we can get into that another time. But again, I'm excited to be here. I really advocated for being on this group, and grateful that I was appointed to it. So looking forward to working with all of you. And yeah, I've got some connections out in the field of psychology and psychiatry. So perhaps there'll be opportunities for us to utilize those too.
That's great. Thanks, Tim. Glad you're on the panel as well. Next, we'll jump over to Chetney. You're on mute, though.
Thank you. What a really well-qualified group we're working with here. I'm Chet Nelson. I'm a marriage and family therapist, currently working full-time in Broomfield. I've recently moved to Superior from Kansas. I'm working for a company called LifeStance Health. I recently retired from government service. I worked for the last 15 years at Fort Riley Army Post, where I was working in behavioral health there. Originally off the farm, grew up in Northwest Missouri, mixed farm and purebred limousine cattle. Did 4-H and FFA and all those things like most of you had. Worked in agricultural technology for a while, and in 2000 went to Colorado State and I got a master's degree there in marriage and family therapy. Really happy to be a part of this group. I wanted some opportunity to get back into agriculture more and get more plugged into my new community. So thank you for letting me be here.
Thanks. And do you prefer to go by Chet or Chetney?
Chet's fine.
Right on. Thanks, Chet. Isabella.
Hi everyone, I'm Isabella. I am part of a fourth generation family farm located in Rocky Ford. Agriculture has been a pretty big part of my life. I recently completed my bachelor's degree in physiology, along with a certificate in public health at CU. Currently on the family farm, I'm responsible for the food safety, managing audits, and training the employees. I joined this group because my experience growing up on the farm has made me realize how critical it is to prioritize mental and behavioral health. The challenges of continuing to operate a farm can be taxing, and working alongside my three brothers who all want to continue to farm has shown me the importance of balancing the demands of agriculture and the need to prioritize behavioral and mental health and focus on the youth mental health as well.
Right on. Thanks. Chad, over to you.
Good afternoon, everyone. My name is Chad Resnichek, and I grew up in central Nebraska, a small farming community, and spent most of my summers and all my free time basically helping out at my grandparents' farms. I was a therapist for about 20 years in New Mexico and Colorado. And about 3.5 years ago, I had the opportunity to join the Colorado Agribility Project as a behavioral health specialist. We've since been incorporated into Colorado State University Extension, and my title there is Behavioral Health State Specialist with Extension. We are also part of a partnership called the Western Region Agricultural Stress Assistance Program, which works with all the different land-grant universities and other organizations doing outreach for ag behavioral health across the Western states. And so I feel very fortunate to have been able to do a lot of this work. Oh, I should also mention, I also partner with the Colorado Farm Bureau to help provide some administrative oversight of the CAMP program, which offers 6 free therapy sessions for anyone in Colorado agriculture. So proud of all those pieces. As I mentioned, we've been doing this work for about 3.5 years. And in that time, we've been trying to do a lot of outreach, preventative education, doing presentations, sharing information and resources, also kind of directly linking producers up to some of those resources. And I can absolutely say that any level of success we've achieved is because of the amazing partnerships we've had. Meaning the people who we partnered with are also represented on this panel. We look forward to being able to expand that because we know that working together, making sure we're not reinventing the wheel, helping connect people engaged in the right projects at the right time is a big part of this. And so I'm honored to be part of this and hope to continue to best serve our Colorado agricultural producers, farm workers, and their families. So.
Right on. Thanks, Chad. And I don't see Tom on the call. I'm not missing Tom, am I? Next, we'll move to you then, Jacob. Good to see you, man.
Good to see you. Growing up, it was never fun being the person with a W last name. You always had to go last, but when you're introducing yourself, it's not that bad. Hi, everybody. I'm Jacob Walter. I live in Fowler, Colorado. I guess the Colorado part makes sense. I'm sitting here in my office in beautiful, snowy Pueblo. I grew up on our cattle ranch in southeastern Colorado between Trinidad and La Junta. And in 2016, we lost my dad to suicide, and that kind of sparked my involvement in rural mental health and a focus on that. It was never something that had ever really crossed my mind until that happened. And in 2018, my family was honored to get to share our story to help others through what's called Rusty's Story with the Department of Ag when that mental health toolkit was created. And then I got to serve a little bit on that mental health task force for a while. And then recently, we were able to be part of the legacy film between a bunch of different partners. I've been very blessed to get to help with the CAMP program that's been mentioned a couple times. I'm sure we'll talk more about that. But my main job is I'm the Associate Director of Statewide Initiatives and Outreach for CSU Pueblo. So I oversee our rural outreach efforts in that team. And I get to impact some different communities through our work there. I also volunteer with Colorado Farm Bureau in some different ways. So I get to wear a lot of different hats, but a lot of my hats that I'm going to wear for this one, I think, are centered around my family's experience. And that's a big chunk of why I wanted to apply to be part of this group. It's good to see so many friends and so many faces on here. It's also, I think, even looking back to 2016, just the advancement of all the different programs and the different supports that are out there for folks. I know we're not there yet, and that's the purpose of this group, but just to see how far those services have come and the focus on mental and behavioral health is very uplifting. So very excited to get to be on here with you all.
Absolutely. Thanks, Jacob. Yeah, I'll echo what Chet said. It really is an awesome group that we've got here. And I look forward to the rich discussions as we dive into some of the initiatives from that the work group was tasked with. Robert, you just pulled down the slide, but I was going to just let everybody review those work group requirements. I'm not going to read them. I'll let everybody read them quietly. And then if there's any questions that we want to discuss before we move on, we can do that. But I'm guessing that you've all probably read these in some capacity through that legislation, but we can take a couple minutes just to read through to refresh our minds of what they were.
Then also, Clinton, Olga's been putting in the chat some links to some of the things that everybody's been talking about. So you can check out the chat and I'll have some links there.
And one thing I didn't say at the beginning is that a copy or a link to the agenda, I think, is available on the CDA webpage. If anybody who's not on the panel or is on the panel wants to pull up the agenda, if you don't already have it pulled up. But I'm not exactly sure where that link is. If somebody wanted to drop that in the chat, I think it's available for public view. And I'll just give us another minute or so to finish reading through these. Any comments on those work group requirements or anything that sticks out that anybody wants to just note that either you're excited about working on or that you feel like we should, I don't know, question right now for clarification? Like I said, we'll dive into this a little bit more. One of the things we're going to talk about in a minute is creating a work plan, what this looks like, and we're pretty much going to be working to address that. But one of the things also that we need to do is create a charter. And I'm pretty sure that on an agenda that was shared with you all, there's a draft charter that you can review to see what that is. If not, I'm sure that Robert can share it with you, but I'm pretty sure that on the agenda that was shared before this meeting, maybe last Monday, there's a link that says draft charter under bullet point 6. So one of the things that Robert and I will work on is trying to create a finalized charter before our next meeting. But if you all can pull that one up and review it and offer any feedback to Robert before January 10th, he and I can work together on that to try and get a finalized draft before our next working group, which we'll discuss the 25 schedule, but right now is scheduled for January 28th.
Clinton, one thing I failed to mention in my introductory remarks, and part of this will be in the charter, is that the legislation requires representation of certain groups. And one of the groups that we're lacking representation from right currently is the tribes. So we're going to get clarification on that. I know the tribes are under a lot of pressure right now. Everybody wants to consult with the tribes right now. But so if anybody knows anybody from either of the Colorado tribes that would be interested in joining our process, please pass along our information to them and we'll be in touch with them. And then I'm going to clarify, I failed to do this, Clinton. You had asked me to do this, and I actually failed to clarify if it has to be a member of one of the tribes or not. And I'll research that and get back to you.
Great. Thanks, Robert. And just to clarify too, the tribes that we're talking about is the Ute tribe and the Ute Mountain tribe that I think are both in the southwest region of the state. But we would like to find somebody to represent from that population. Any other questions on the charter? Does everybody know how to find that on the agenda that was sent out to you?
Clinton, there was a question on a gap in diversity from the public on representing farm workers who speak Spanish as another gap.
Excellent. So as we go along, and Robert, you can correct me here, but we will be adding in some participants in the working group that do help represent these diverse underserved populations that may not be represented yet. So if you have somebody that you have in mind, either reach out to us and we can reach out to them, or have them directly contact us, because we would definitely like to have those voices in the working group.
Definitely.
All right. The next slide is about creating a working plan that will kind of guide our work around those guidelines that we were given from the legislation. Robert and I will be working together with Megan and Catherine on this, but any of you are welcome to be a part of this group as well. And essentially, it'll be a little extra work, but I'm hoping that once we get this formed, it'll just kind of be in flow, but it'll be kind of some pre-work before we get going on this. So if that's something that you're interested in, please reach out and let Robert know, and we will get a meeting scheduled probably sometime the beginning of January to meet to kind of go through those and work out how we want to address those issues as a working group and a team. Anything else you want to say about that, Robert?
No, we just welcome anybody's input. We'll go over this, I think, in the next slide, just so you're all aware when you're thinking about this, is that it's a pretty aggressive schedule set out by the legislation, in that the legislation requires us to meet monthly. And so we'll talk a little bit about how the group feels they'd like to approach that requirement, and a little bit going on. But yeah, anybody reach out to me anytime.
So this aggressive schedule that Robert's talking about is a monthly meeting. And what we had talked about, Robert and I, before we started, is to maybe not have a full meeting each month, but to have a shorter meeting and then have a extended meeting. Regardless, the plan is to designate the fourth Tuesday of every month between 1 and 2:30 as kind of a placeholder. But like I was saying, 1 month maybe will be a check-in, and then the next month will be a deeper working session. And then if you're not able to attend, if you can send a representative in your place to kind of come with notes or things that you've been working on, or somebody that can participate, we'd appreciate that. And Robert mentioned this at the beginning. We would like to focus in on some things. JC mentioned the coffee break project. Chad and Tim mentioned the camp program. And we were thinking that maybe each of the longer meetings, or in the check-in meetings, I don't know, we can decide. But if one of the participants would just highlight a program or do a presentation about something that either you're directly a part of, that might be an opportunity, Michael, for you to talk more about the work that you guys are doing at Warhorse Ranch. But highlight that. And on this, it says that we'd like to have over the next couple of months. I would really love to give each person that's directly involved in running a program the opportunity to share more about the details of those programs, so the rest of us can know as we're working through. So does that seem helpful or reasonable to you guys? Is there a better way that we would want to do that? Thumbs up. Okay, then maybe Robert and I will look at the schedule when we're doing the work plan, or whoever's on that work plan planning committee, and kind of figure out ways to distribute those over the next couple months so that we can get updated here at the beginning and know what people are involved in. I guess that's kind of, I did both bullets together, but if there are particular topics or maybe another program that you know of from another state or somebody that's not represented on this, if maybe you want to come off mute and let us know right now, or send an email to Robert or I. And maybe as I'm saying that, if you send an email to Robert, since I did agree to take on this chair position, if you could CC me as well. I think that we've all been on an email now together, so that we should have each other's emails, but CC those so that we're both covered in that and are aware of what people are sharing. Any thoughts on this schedule? Any thoughts on those last two bullets about presentations or people sharing about their programs? You guys are agreeable.
Would there be any interest to have an in-person meeting? I know, again, the group is so diversified across the state. That's why we decided for sure the kickoff meeting would be virtual, and probably the majority of meetings will be virtual, to be honest with you, because I know travel is so hard, especially when it's snowing like crazy, which sounds like it is in Pueblo right now. Would there be any interest in having an in-person meeting?
I'm throwing some thumbs up as well, and we can do it at any time, but like you just said, Robert, might not be good to do it during the snowy season, but I'm guessing there's some pretty beautiful spots that we could choose to do later this spring or this summer. It'd be great to be in person with you all.
Right, I agree. So Clinton, let's keep that in mind. Maybe one of the meetings this summer we try to do in person, or at least hybrid.
I know a really beautiful spot up in the mountains outside of Routt County that has some pretty cool facilities. I think Michael knows a similar place.
Oh yeah, there's quite a few, and the winter is our our winter wonderland. Yeah, we could do a winter one here with a little bit of perks. So
that's right. All right, so we'll talk about that, Robert, and we can bring that to the meeting next time to see, so we can get it on people's calendars.
Perfect.
All right, and that gets us through our required agenda items. The part now, I think I'm going to pass over to Bethany and let her facilitate any public comment before we do a working group training at the end. But before we go to public comment, does anybody on the panel have anything that they wrote down or have been dying to say before we wrap up that last portion?
Clinton, this is JC.
Hey, man.
My hand is showing on your side. I'm wondering if we have rules around Carl's open records and open meeting laws. If we do, we probably should have a little bit of a training on that, because there are specific requirements around how many of us can gather outside these meetings and have conversations, even if they're unintentional, about the work we're doing. I know I serve on a committee with the Attorney General, and those rules are pretty clear. So we may want to visit that if we have to follow those guidelines and laws.
And we do have to follow those guidelines and laws. Apologize that I didn't see your hand raised with your white background and the white colored hand. It was hard to see, but thanks for speaking up. Hopefully at the end of this training, Bethany's going to be able to walk us through some of those. And if we don't get to it today, it'll be at the top of our agenda for the next one, because I'm definitely not well versed in that, JC, and I'm guessing that it'll be good for anybody else on here to have a refresher. So thanks for saying that. All right, with that, anybody else have a hand that I'm not seeing? Come off mute. Bethany, I'm handing it over to you.
Okay, thank you, Clinton. We did have one question in the chat and asking about whether community mental health centers are represented here. So if anyone in the group does represent a community mental health center, I would love to hear from them.
So that would probably be me with Valley-wide Health System. I was the CEO of Southeast Health Group, which is a community mental health center in Southeast Colorado. We merged with Valley-wide Health Systems, and we still are a member of the Colorado Behavioral Healthcare Council. So I would say the answer is yes, and that would be me, JC, with Valley-wide.
Thank you, JC. At this time, I am not seeing any other questions for public comment. I do want to note for people who are listening on the call that we will have a Google form available on the website. So on the Ag Behavioral Health page, we'll have that form available for the next meetings for pre-submitted questions and comments. So if anything comes up from this meeting or things or topics that you would like to make a comment on for upcoming meetings, that will be available.
And then again, too, any comments, if you think of something after the meeting's over, anybody listening in the public, my email address is on this slide. Don't hesitate to send comments, questions to me at any time.
Thank you, Robert. And while you were saying that, we did get another question from Julissa Soto, who is asking if you were planning to include cultural validation into the mental health approach. So open for the group to answer that question as well, I guess.
I'm going to open that up to any of you working group members that feel like you can speak to that.
Again, that question was about including cultural validation into your mental health approach.
I think it's important because mental health does not discriminate, as we all know, and the more we could reach out to people, the better.
Great.
Well, as a practicing therapist, it's a very important part of any mental health provider's ethics to pay attention to the cultural and spiritual needs of the patient, and it's also very well addressed in the newer version of the Diagnostics and Statistics Manual. So I would say yes, that's a very important part of any practitioner's practice.
And this chat, I would further add that in some ways the spirit of this entire group and committee is based on that notion, with the idea being to really look at trying to tailor resources, understand needs, and be responsive to this particular segment of the population involved in agriculture. Now, granted, there's significant diversity within that in terms of languages and culture that also needs to be even further, I think, fine-tuned. But I think that is very much the hope of what brings us all together here, that we can look at how do we develop something that is in the best interest of this entire section of the population. So thank you. Great question.
Great, thank you all. And so far that was our last question. So we can keep going on the agenda.
All right, then. I guess our next steps and action items before we turn it back over to Bethany is just making sure that Tuesday, January 28th, 1 to 2:30 works for the majority of you. And if that's the case, can we kind of as a group give a thumbs up to the ongoing fourth Tuesday of the month between 1 and 2:30? Does that seem to be a time? Yeah, I'm seeing all thumbs up. This is great. That's remarkable. Um, and then just a reminder on Robert and I will be working on the draft charter to bring back to the next meeting. If you can offer him comments, read through that by January 10th. Note that, and then please CC me on that. And then the CDA website review. So as we started this conversation planning this meeting, one of the things that came up was the CDA kind of requesting this group to help them recognize any gaps or updates that may be needed on the CDA behavioral health page on their website. And so if you will take some time as well before our next meeting to review that and just see if there's any additions, anything that seems out of date, anything that seems to be off that you'd like us to support them with. We'd really like to help make that a resource that we can hand out that people across the state can use. And they've asked us to put our eyes on it to offer feedback.
We'll send you a follow-up email with the links. That's why I put the QR codes too. We'll post this video. So just in case you can't remember, people later on that see this video can use the QR code to access them as well.
Right on. Thanks, Robert. And so any other action items or next steps, Robert, or anybody in the working group that you want to say before Bethany gives us some training insights?
No, Clinton, I don't have anything else.
Right on then. Well, if that's the case, then Bethany, I'm turning it back over to you.
All right. Well, hopefully everybody can hear me and you can see my slideshow. So
Everything
great.
looks good. Yep.
Perfect. Well, you guys get the pinch hitter today because unfortunately Jordan Beasley, who normally does our boards and commissions training, is at the JBC hearing this afternoon as well. So I'll do my best to answer questions, but definitely want to get to JC's point that there are some pretty important things to note about being part of a work group or a commission like this. So this is just part of a training that we give across the board. So I'll kind of move quickly through some of these slides, and then please, if you have any questions, I'm not able to see everybody right now. So Clinton or Robert or whoever wants to jump in, and if somebody has questions, just let me know. Yeah, thank you. So the first thing to know is just that there are some statutory obligations, which you guys have already gone through. And I would encourage you, if you haven't already, to read through the statute that applies to this working group so that you can have a better understanding of the particulars, because every single work group, every ag commission, every board has their own unique flavor. So just know what it is that you are supposed to know as a work group member, and that's the first big piece of that pie. So just really quickly, if you're interested, it's a really amazing infographic. I think you guys know how much importance Colorado agriculture has to our communities. And so I thank you again for your time and effort being part of this working group. I should say that I actually live in the San Luis Valley and I'm in Del Norte, so I fully understand what it is like to be in a rural community. I think maybe we should have seen how many of us grew up in rural Texas before we got on this call, because I also grew up in a very small town in Texas. In an ag community, and was part of that with 4-H and FFA and all of that. So it's very close to my heart as well. So appreciate everyone who is on this call today. So just really quickly, since you guys are part of a board that is working through a working group that's going through CDA, this is just a really quick overview of CDA. The ones that I kind of want to point out for you guys that our staff has developed is these core values. And so this plays into how our staff will work with you and will work with our ag communities through respect and professionalism, with partnership, which is what this group is all about, with service, and being proactive. So I know Robert has already done an incredible job of showing all of those core values as he has been trying to pull this working group together. So that is something that we feel very dearly about, and so want to make sure that you guys know that that is part of our core values. And then just kind of quick overview of our 9 divisions and staff and all that make up CDA. So the commissioner's office is what this working group is being run through. So Robert is a member of the commissioner's office. And so there's a few different things, and I do want to keep this on here because we want to be able to support you as much as we possibly can. So these are some ways that the commissioner's office can help to support this group. And that is through some of this administration of this group, CORA requests, which I am the CORA, or Colorado Open Records Act request liaison for all of CDA, which we'll get into CORA a little bit later. We also have Olga Roback, who is our public information officer. So should there be anything that comes up where there is potentially questions from the media, I know this type of topic is really important to many people in Colorado. So we will help to support if there are any media requests or anything that comes through on behalf of this group. That includes press releases, keeping our website updated. So please let us know if there's something on the website that is incorrect or information that you would like to see on it as a working group member. And we can definitely talk about that and then keep that updated on CDA's side. And then also helping with any outreach efforts, which is going to be a large part of this working group's thought process as you work towards doing an annual summit. That is something that we want to support through our commissioner's office staff as well. And then should we get into any of the business side, which I believe the statute has some money set aside for some for activities like the summit, we can help with the procurement, accounting, all the fun stuff of budgeting and contracting and all of that good stuff. And so hopefully we won't have to get human resources too involved, but so those are some things that the commissioner's office is going to support with. Really quickly, this working group falls under one of CDA's 4 departmental goals, which is not readily apparent, but I think if you look at number 2, which is developing agriculture leaders, we want to make sure that we have people who feel supported in the ag industry, not only as a new leader, but also, market access for ag businesses. I mean, there's a huge amount of stress that comes from owning and operating your own business. And so while we do want to expand market access, part of that is understanding what are the challenges and obstacles that people are facing. And that definitely falls under the mental and physical and emotional strain that people feel. So that is one of our goals, is to help to support in that area as well. There's also stressors that can come up from climate resiliency, water. I know that Robert has been just talking to people all across the place, and water is a huge stressor, no matter where you're living in Colorado. And then finally, our other unique stressor that we have just come up in the last couple of years is this reducing predator conflicts. So if you're in the Northwest in particular, that is something that is probably weighing on your mind quite a bit as a producer, is how are the wolves going to impact my cattle, what's going to happen in my area. And so that's just in the back of minds as well. So recognizing that this working group has a stake in every single one of our departmental goals in helping us to reach producers so that we can advance Colorado agriculture and recognize that there are some stressors that definitely take place within each of these goals. And then internally, we have a strategic plan that we are trying to work towards, and you guys are part of our strategic plan. So we have some different markers that we are going through just as our agency, and this is just specific to Colorado Department of Agriculture. And so number 1 is the really big one, is people and community, and that's why this working group is so important to Commissioner Greenberg and to all of our CDA staff, because we have so many people who are working in the field, inspectors, people who are regionally based like myself, and we see it happening within our communities, and so supporting them however we can. And then all of these other ones kind of also just have their own goals and objectives. You know, the fourth one down here, animal health and welfare, is one of our newest ones. That's our newest division. And that is something that we're seeing has a lot of correlation between what's happening with people taking care or not being able to take care of their companion animals. And there is a correlation there with mental health, with physical health, that can go into their animal welfare ability. So we recognize that there's some stuff internally that we really want to focus on. And again, just our own internal operational improvements is part of this, is being able to support the growth and success of groups like this, and being able to support Robert's efforts here. And so that is part of our bigger CDA strategic plan. So the success of this group is very important to CDA as an agency. All right, now the fun stuff. Some of the authorities of boards and commissions. So we are one of the principal agencies along with Behavioral Health Administration. So again, we can kind of help with all of the administration part of things, with any accounting. We are advocates at the legislature, and with talking with, you know, helping you guys and helping to advocate alongside you. I really liked hearing from JC about just, you know, the effort that it took to get this bill passed. It definitely takes not just a village, but an entire state of people working towards these goals. So again, our agency is here to help that happen. All right, so you guys don't have to worry about this too much because you are not a board, other than you are you don't have a huge amount of responsibilities, which is great and kind of a relief for you all. You're not having to you are making recommendations as authorized in statute, but everything else will be under your the direction and supervisor of the commissioner. So you don't have to worry about type 1 board responsibilities. So type 2, you know, Robert is your liaison. So Commissioner Greenberg, you know, she's not necessarily going to be directly involved all the time with what you guys are working on, but she's very interested in it. And so you can consider Robert her proxy as part of this group, that any kind of recommendations or things that you come up with that Robert will help guide you through will be on behalf of Commissioner Greenberg. And then again, I highly encourage you to go back into the statute and see exactly what it is that you are required to do as a board, which you guys have a good start today. All right, so legal advice. If there are any kinds of questions on these big ones that are listed here, so, you know, what exactly are your statutory powers, duties, and functions? Where is there going to be a conflict of interest? So if, for example, you're, you know, trying to approve a contract and it is on behalf of an organization that you work for, that may potentially be a conflict of interest that you may want to recuse yourself from making a decision on that. So ethical responsibilities, and then as we get into the open meetings law and Colorado Open Records Act, if there are any questions about these, and they can be very scary, you know, legally impacting types of topics, we do have the Attorney General's office, and we have some great staff there that we go to if there are questions that Robert cannot answer. If I'm really not an expert either on the legal side of things, and so if Jordan is not available and Robert doesn't know the answer, we can definitely reach out to our Attorney General's office staff who are really well versed in all of these things. So if you have any questions that I am not able to answer today, please know that we will find the answer for you before the next meeting. All right. So this is a lot of text, and we can share this with all the working group meeting members later. But these are the big ones for the open meetings law, or otherwise known as sunshine laws. So you guys may have heard this has been quite a big thing. It feels like in the last several months that there has been a lot in the news and in other places about violations of this act, and sunshine laws not being adhered to. So we definitely want to make sure that you all feel comfortable with what you're being asked to do and how you're going to go about your business. So generally speaking, this means that any state or local governmental body, which includes this working group as you are part of statute-related business, it requires you to discuss public business or take formal action in meetings that are open to the public. So that's pretty important. So in this definition, also a meeting refers to any kind of gathering convened to discuss public business. And so that can be in person, that can be virtually like we're doing here. It can even be by phone, texting counts. So electronically, so emails, that kind of thing. So those are the big ways that we communicate. So if you have another means of communication that you're using, like Morse code or a telegraph, let me know, because I haven't encountered that before. But you do meet the definition of a local body because you are an entity that's been delegated to make recommendations on behalf of the government. So let's get into some definitions of what does it mean to even be a member. So working group members, you all have been approved by Commissioner Greenberg, so you're locked in for now, unless you want to step off for any reason, and then you would notify Robert, and then you would go through the necessary channels to have you removed as a member. But as of right now, all of you have been approved, and so you are considered members. So if there are 3 or more members of this that are conducting business, you're going to be subject to this law. So that can get a little into the gray area. It says, or 2 members of 2 constitutes a quorum. And I don't know that we are required to, it didn't seem to me that according to statute that you had to convene a quorum. Okay, Robert's shaking his head no. So yeah, so this would be 3 or more members of the body meeting together. So notice of meetings, we're going to do our best to make sure that we adhere to this. This is something that we do with all of our advisory committees and boards. The statute requires that we have full and timely notice and that it's posted in a designated place so that people can easily find it, and that you are in compliance with the notice requirements. So the notice, if it's posted at least 24 hours prior to the meeting on your public website, and that's how everybody knows that it's going to happen, and that's how we have decided that that's where we're going to notice meetings, then we just need to adhere to that and be consistent. For this group, I believe we have just noticed on CDA's website. We noticed through our Ag Connection newsletter, which is our main newsletter that goes out to our ag constituents. If you all have other newsletters or places that you would like to post this meeting, I think we can definitely send that information out, and you can post it in other places as well. Those are just the 2 big ones that we tend to notice through. I think as we come into maybe in-person meetings, especially if you're going to go to a regional location, we might consider doing some public noticing through a local newspaper, for example. That is something that we've done with some other meetings, and that works really well in rural communities where people aren't always on their email or on the computer, but they definitely read that Valley Courier every week like I do. So they might be getting their information through that. So we can definitely explore a couple of other places to do some public notices. That also can be on social media. So if you would like to post, the next public meeting of this group is going to be on such and such date, and you can include a link to the CDA website so they can register for the webinar. You're more than welcome to post that on Facebook or Instagram, make a TikTok, something like that. So just as long as it's publicly noticed, at least 24 hours, but we have some recommendations on that as well we can get into. And then minutes of these meetings. So Rosie is, I believe, our minute taker. And so she is, I'm sure, taking incredible notes right now. And so we will make sure that those are posted alongside the agendas on our website as well, so that people can see the past minutes and past agendas if they weren't able to make a meeting. I'm not sure if this is something that, are you going to approve meeting minutes, or do we need to so that might be a question I'm just going to throw out there right now to maybe consider, is whether this group wants to approve meeting minutes at the next meeting and then they get posted. So we'll have to kind of talk through a cadence of posting public information according to what this group wants to do. Traditionally, you do approve meeting minutes and then they get posted after that meeting that they're approved. So you may not see meeting minutes from this one until after the next month kind of thing. So think about that one as well. And they do need to be open to public inspection. So the other thing is we do take recordings of this. This Zoom is being recorded, and we can post that on our YouTube. So that is, again, a way that somebody can participate in a meeting if they weren't able to make it, or if there's a member of the public who wants to know what was discussed. We will have that those YouTube links available for people to see as well. All right, so then so this is just a definition of executive session, which I don't believe that you guys will be in an executive session as a working group. You don't have, but I could be wrong. So I'm going to put a pin in that one as well. That if you did want to discuss anything, that would need some finagling, and we'd need to discuss if you want to go into executive session before a meeting or during a meeting, because that just requires a little bit of legal discussion and being able to correctly say when you're going into executive session and for what reason, and make sure that we're adhering to the parameters that come with an executive session discussion. So, when does a meeting have to be open? So anytime that you have 2 or more meetings that are open to the public at all times, in which public business is discussed or at which any formal action may be taken. So this is where a little bit of the gray area comes in. If you're like, hey, I went to this conference and there 3 of us from the working group were standing around at the happy hour and we were chatting. Does that mean that it's an open meetings law and that we're in violation? Not if you're not discussing public business according to this working group or making a formal action. So as long as you stay away from, oh, this was an item of business that is on our upcoming agenda, we're going to start talking about it right now. If there's 3 of you talking about it, best to just not do it, and to stay away from it. Avoid all appearance of having talked about business. If you're just talking about, general topics of, mental health, or like, hey, this is something that I was thinking about that would be cool to put on an agenda, that is broader and it doesn't have a course of action taken with it, and it's not a specific business item. And so that's usually where people get a little nervous, is like, okay, when am I in violation of this law? And so again, it's 2 or more members at the public meeting. If it's considered a public meeting, if you're talking about public business or a formal action that you're going to take. So just don't do that. That'd be good. If the meeting is open, any person can join the meeting. That includes members of the press. So that is just something to keep in mind as well. That can be a little hard to remember, especially on virtual meetings where we're not necessarily seeing all of the participants face to face. But just as a reminder, this is a public meeting, so that means anybody can join it. And so just be aware of that as you're having discussions and thinking about things. And so that you can see here that our recommendation is just to treat all conversations between 3 or more board members as public, and really be considerate of what type of topic you're talking about at the time. And then we have some recommendations for actually noticing the meeting. So the open meetings law, if you want to go look at it, does just say that full and timely notice be given. It doesn't necessarily say that it has to be a certain amount of time. But anytime you're going to do a proposed policy adoption, resolutions, rules, formal action is going to occur, the majority of the work group is going to be in attendance, we need to notice that publicly. And then that's not usually an issue. Again, for CDA, we're pretty used to it. So our recommendation at CDA is to try to notice them all a week in advance. That gives people plenty of time to get registered for a webinar, to have any pre-submitted questions or public comment, and to find us. So if there's anything that you guys are sending out again, on your own kind of social media or through your newsletters. We do try to notice it at least a week in advance. If you guys have standing meetings, which it sounds like you all are trying to put a standing meeting in place, we can just post those as well. And then, you know, it's like second Tuesday of the month, 2:30 to 4. Like that's the time. It's been publicly noticed now for the next however many months. So it's a little bit flexible, but we're going to try to be consistent with it. So we try to do 7 business days ahead. Time, again, think about the way that you're going to get it out to your constituents, to people in your circles that you want them to know about it. And again, just we can publish the standing meetings for the year and have it in a regular cadence so that people get used to it, which is highly recommended. All right, so we're almost at time for the end of this meeting. So I'm going to pause on this and not do Cora until you meet again, which is Colorado Open Records Act. But does anybody have any questions or concerns? Did I just make you even more confused and fearful about being part of this? Or did I hopefully made you feel a little bit like, okay, it's not so scary. It's not really that hard to adhere to sunshine laws.
Bethany, the one thing that I'll say, thank you very much. Beyond thank you very much. That was great. I appreciate all that. But our time, so that people are not confused, is the 4th Tuesday between 1 and 2:30. And I know that Bethany was given an example, but I didn't want you to get confused with that date as well. So the 4th Tuesday, 1 to 2:30, and our next one is January 28th. But that was just clarification.
Right. That's all right. I love to be corrected. Any other questions? Seems like everybody is feeling pretty good based on the faces that I can see. And again, you know, we are here to support at CDA. So if there are questions or anything that comes up as you guys are having these discussions, if they're at a point that you get nervous and think I need to have some more direction on this, you know, let Robert know, and he knows the people to go to.
Yeah, reach out to me at any time. And then also you'll notice in the statute, there is a provision for anybody, you know, that financially isn't being compensated to participate in this process. We have some funds to compensate you for your participation. So, you know, reach out to me if that's the case, and we can see what we can do there.
Excellent. Then it seems like we're at time. Thank you for all of your time today for joining. I look forward to getting to working with all of you over the next year. And Robert and Bethany, correct me if I'm wrong, but is this a 2-year working group appointment from that legislation?
I believe so. I think you're right, Clinton.
Okay. So if at any point it no longer works for you to serve on the working group, that is a process that Robert would go through to take you off of this. But this is a 2-year process that we're agreeing to support. And I do believe that together we're going to be able to do really awesome things. If you know anybody within the Native American population here in Colorado, or the Spanish-speaking, particularly ag working group population, please refer them to Robert and I, or make a connection. And anything else anybody has to say before we adjourn? I don't know if that's actually what we do, or we just finish. Shaking heads is good. All right then, Robert, anything we need to say to bring this to a close?
No, just thank you, everybody. Thanks very much for your willingness to participate, and, you know, wishing you the best for the holidays. I know holidays can be the toughest times for some people as well. So keeping that in mind as we move forward, I think is important. So thank you, everybody.
Mm-hmm. And thank you to those of you that are supporting from the CDA, Olga, Rosie, and thanks for your help, Bethany and Maite, for your translation. Really good to be with this group. We'll see you in January.
Thank you, everyone.
See y'all.